Hello, everyone. My name is Elinor Larney. I'm the Registrar for the College of Occupational Therapists. Welcome to our webinar this afternoon. First of all, why does regulation matter? It's important, the regulation of health professionals matters because it does protect the public's right to quality healthcare services. The college sets and enforces our standards and guidelines for the practice and conduct of its members, which are occupational therapists. We also take action when members of the public have a concern about their healthcare. So what is the role of an occupational therapist in self-regulation? Part of it is to be part of what is happening at council. So taking an active part in the election, either by supporting somebody else's nomination, your own nomination, and voting. Get to know the people that are putting their names forward and participate in that process. You may also want to stand for election, and then of course, if you're elected, serve on council. So that is one of the roles of occupational therapists in self-regulation. There's many other things that occupational therapists do, even by just going onto our website, reviewing standards, participating in quality assurance is all part of a role of an occupational therapist in self-regulation. So what are the roles of council members? Very important that everything that a council member does is in the public interest. That's different than being on an association, for example, where most of the things that are happening are in the interests of the profession. We are here for the public interest. One of the other things that council members do is participate on statutory and other committees. So not only are there council meetings that occur, but there's also committee meetings that help the college run. The council makes decisions about what are the standards of practice for the profession, what is the expected professional conduct for occupational therapists, and when would we intervene? What are the competencies to become an occupational therapist and while you're an occupational therapist? What are the policies, regulations, and bylaws that the college needs to have and keep up to date that also align with our legislation, which would be the Regulated Health Professions Act, as well as the Occupational Therapy Act. We also have programs of the college that are in alignment with the legislation that help us with enforcement, and we also ensure that all the work we do is completely transparent. College council meetings are open to the public, and the deliberations and the decisions that are made are scrutinized and, of course, accountable to the public and the Ministry of Health. So some current college activities that we're working on. The first one is Core Common. That's a bit cryptic, but that is our core competencies for the profession. This is a national document that will be used by both colleges as well as universities for teaching occupational therapists and for the college in our quality assurance program, and also to hold occupational therapists accountable for what we expect. In addition, the national certification exam will also be based on this one set of competencies. And so it's a pretty exciting project. We're aligning all of these. This is a project that's been funded by the Government of Canada, so we're very excited to be able to do this. That project should be wrapping up in early 2021, and then it'll take a bit of time to roll out those competencies throughout all of our programs. One of the other big initiatives is the review of governance. So you may have noticed that we are right in the midst of a bylaw consultation, and that is around our governance structure. So some of the early changes we want to make is changing the name of college to, or not the name of the college, the name of the council to a board, and that we would have directors of the board as opposed to council members. We are also hoping to move towards an increased involvement of public members on our council, such that we would have an equal member of professional and council members. Another change that we're looking to make is the change to our committees. So right now, most of our committees center around the statutory requirements of the Regulated Health Professions Act. So we have a committee that looks after the registration requirements. We have one that looks after quality assurance. We have one that looks after complaints, and another for discipline. And while all those committees are very important and will need to stay, what we also need to do is look at the governance of our college and think about some committees that will help us do that. So one of the new committees that we will be implementing in the spring, if all goes well with the bylaws, is Finance and Audit Committee, as well as a governance committee that help the council or the newly named board to do their work in the best manner possible. So that's a big initiative. It's happening over 3 years because we want this to be an evolution of changes, not really a revolution. So we're continuing on with our current elections process. In the future, we really want our elections process to be a competency-based process. So people would stand for election based on the competencies that they have to act appropriately on a board. And that is the way many college boards or councils are moving, and that would be moved towards best practice in governance. So that's what we want to do. One of the other big changes that we're working on is performance measurement. So the government, the Ministry of Health, has developed in consultation with a lot of colleges a measure. It's a bit beyond an annual report, but it is about how to measure the performance of the college. And part of that is to make sure that we're doing our public protection role and not slipping into advocacy, that we're actually meeting quality indicators like registering people on time, managing our complaints properly, and that we can compare all of those things across all the 26 colleges in Ontario. So that's a big job. The first one of these measurement tools will be completed by March of 2021. So the college staff are busy working on that, and council will get a chance to look at that. We're also in the midst of retooling our quality assurance program. We want to ensure that the program is a risk-based program, so spending the most time with the people that are at highest risk of having some competency concerns. And so that's just about ready for full roll-up. We're just changing, we're doing a few new things to it, but you'll be seeing some changes to that. And we've also changed our current processes to be virtual because we clearly can't have in-person competency-based assessment in the middle of a pandemic. Another thing that we're working on is our focus on diversity. Last year, you may have noticed that when you completed your annual renewal, we had a question about Indigenous identification. That's one of the very small things that we're doing just on the road to help us with fulfilling the terms of the requirements, or I guess maybe the recommendations from the Truth and Reconciliation Agreement. So we felt that the college had a big role to play in knowing how many, like what are the numbers of occupational therapists who identify as Indigenous. One of the recommendations in the Truth and Reconciliation report is to ensure that there are Indigenous members of professions, and so that's one way we can help. There's a few other things we're working on, and is some expectations, more clear expectations for occupational therapists and their role in supporting the diversity of our province. So in terms of meetings and time commitments, this is sort of the nuts and bolts of things. So this election is for a council role, and I mean, that'll slowly be changed to board. We'll be on the board of directors for the college, and it'll be for a director. But right now, the bylaws haven't changed yet, so technically it's still a council role. It's a 3-year term, starts March 28th, and that will be the council meeting on that date, and will end 3 years later. And we expect all those terms to end as we change our council. We will slowly phase changes in as opposed to dropping people's terms and that sort of thing. The expectations are we have 4 to 5 full-day council meetings per year. And in the past, we would have been at the college premises in downtown Toronto, having a face-to-face meeting. Right now, we are having our meetings virtually. And so we changed our format a little bit. We do hope once the pandemic is over to get back to our face-to-face meetings, but for now we're doing them using our virtual platform, and probably 4 days this next year. And they're during the day. And we also have each council member would serve on 1 to 2 statutory committees or a subcommittee or some kind of working group that typically meet once per month. And again, these are all virtual right now. I think that when we come out of this pandemic, there will be a combination of virtual and in-person meetings, just depending on how much work the committee has to do and the kinds of decisions they're making. Definitely for some committees, we can shorten the meetings and do them virtually. For other committee meetings, they will likely be more effective done in person. There's usually some prep time required ahead of a meeting, so there'll be a package that staff will prepare, and then they'll send to you. Our goal is about a week in advance, and we do expect all council members to come and prepare to their meetings. We don't read the documents to you, but we do expect that everyone's ready and able to make decisions. So you're probably worried about how do I know if I can do a good job on council? Well, we do provide you with, we hope it's a good orientation and onboarding process. There's an orientation just to be on the council meeting, and we also provide ongoing education to council members as things come up. We would bring certain educated speakers who would let us know about things that we need to make decisions on. So for example, last June, we had our lawyer come and talk to council members about how do you make decisions free from conflict of interest, and how do you manage those kinds of situations when you're making decisions at the council table. So that kind of training is ongoing. Also, for any committee that you would be serving on, there would be an orientation prior to each committee meeting, so you know what you're supposed to do. And we also, if something new comes up, we'll make sure everybody knows what to do and how to manage whatever new processes come along. So there is lots of learning and development. In our October council meeting, we had 2 Indigenous leaders come and talk to us about the Truth and Reconciliation Agreement report, and gave us some recommendations for where they thought the college should go with that. It was excellent and got a lot of good feedback about that. And of course, staff support council members as much as they can. So they make sure that the committees are all ready, that the work is all done, that background information is done. And so you're there doing your decision-making job, and you're not like a hands-on operational person. You're very strategically placed on the board. So what do you need in order to participate on the council effectively? Well, first of all, everybody for election needs to be registered. On our council, we have public members that are also appointed by the government. So we work together with those public members, but the elected members all have to be a registered OT. One of the exclusion criteria is if you've had a discipline finding within the past 6 years or some other type of concern that would exclude you. Those are all listed in our bylaws. Within the past 6 years, no concerns can be identified. You have to have the ability to make decisions in the public interest. So while I would say you can never really take off your OT hat when you're an OT, but you have to be able to see things from the perspective of the public and say, well, if this decision was in the public interest, what decision would I be making? You need to be an effective communicator, because part of serving on a board or a council is participating in discussions, bringing your opinions forward. That's why you're there. And so making sure you're able to do that in a respectful way is important. And also, because we're using a lot of technology these days, you have to be pretty comfortable using technology. So being able to participate on screen, because our meetings are public and they're on screen public, we have to make sure that people feel comfortable being on the computer and being able to manage those technologies. So having internet that works well. I think almost everybody's had an opportunity to use Zoom or some other platform, so that would be something that we would require some competencies in. Ability to participate in collaborative decision making. There are 18 members on our council right now, and not everybody always agrees. So how do we have respectful conversations? How do we collaborate in making a decision that's in the public interest? How do we make sure we have all the information we need to make a good decision? And some of that decision making requires you to be analytical, rational, and objective. Understanding about what is right now. We have to take human rights into account when we're making decisions about people, which are occupational therapists, making sure we have a good understanding of human rights and understanding social justice as well. And we certainly will provide training about these things as we go along. We need council members to have integrity and stand behind what they do and say, and be able to come to council member meetings free of conflict of interest. We also need to make sure that you can actually do this work. Do you have time? Can you attend 4 council meetings per year, as well as committee meetings that might happen once a month? So it would be good for you to speak with your family or your employer to make sure that if you want to stand for a council meeting, a council member position, or if you want to nominate someone, that they understand that there is time that you would need to be able to set aside during the day to participate not only in the meetings, but also in preparation for these meetings. So in terms of what's going on, the time frame, March would be the first council meeting that the newly elected members would attend, and they attend the meeting for observation, but then they become involved with the election of officers. So we do elect our executive, which is 4 people, so 2 public members and 2 council members are elected to serve as our executive on that very first meeting. We have a council meeting in June, October, and January. Typically in October, we would try to plan a 2-day meeting. Now, just because of the pandemic, it's very difficult to sit on a virtual meeting for that long, and definitely we didn't want to do it in public, so we did not do one this year. We're waiting to see what's going to happen next year. If by October we have a bit more leeway to have in-person things, then we'll consider that. But that's generally how it goes if there's not a pandemic. So we do have some committees so in case you want to know what the committees are, so there's the executive committee, and their role really is to help the council meetings progress. So right now they're looking at they're looking at all the information really that comes forward to council and getting the council agenda prepared. They will look at the finance information and recommend that council approve it. They would forward any practice documents that have been developed from our practice issues subcommittee and make a recommendation that council would approve or make some changes there. So that's what the executive committee is. The registration committee is in charge of ensuring that the rules, so how do you become an occupational therapist in Ontario, are all fair, transparent, and objective. And our rules are regulations, so they're written in law as well as we have policies. They also make decisions about registrants that maybe don't meet a requirement, and then anybody who doesn't automatically meet all the requirements has to go for review by the registration committee if they want to still try and register, and then we make a determination about whether, or that committee makes a determination about whether that person could be registered or if there needs to be any limitations on their registration. The Inquiries, Complaints and Reports Committee is a screening committee that looks at all of the complaints or the concerns or matters that come before the college about occupational therapists. And then they make a recommendation about, is this serious enough to warrant a discipline hearing, or is there some sort of education or other way to dispose of that complaint, or is the complaint not a concern, in which case it would be dismissed. So that's what that committee does. The discipline committee hears about registrants or concerns that are very serious and require discipline. Thankfully, we don't have too many of these, but all discipline hearings are posted on our website and the outcomes are made public. Fitness to Practice Committee is there to manage concerns about registrants who might have some sort of concern about their ability to practice safely and ethically, whether it be a health matter or a substance abuse matter, something like that, where they're not taking steps independently to manage the safety of their practice. So then the Fitness to Practice Committee gets involved. The Patient Relations Committee, their job is to ensure that the relationship between occupational therapists and their patients are effective and free from any kind of abuse, whether it's boundary crossings or sexual abuse. So they're also looking at that, the relationship between patients. How do we get patients involved with the decisions that the college makes about standards? How do we make sure that the patients know about our public register, that all occupational therapists are on there, and people should be checking that to make sure that there's their person that they're working with is a registered OT, and that there's no concerns that they should be concerned about. And finally, our Quality Assurance Committee, that might be the processes that most registrants or OTs are more familiar with, and that committee sets out what those quality assurance requirements are. So they're the ones who are looking after what the prep module topic is going to be, the self-assessment tools, what the competency assessment process all is, and they would take action, make recommendations for any registrants who are having some competency-based troubles and recommending some education to improve their practice. So those are our committees. Some more logistics. So this time for elections, there's 3 positions coming up. And we do have 6 voting districts, and usually every 3 years the position comes up. So when people are elected, they're elected for 3 years. And this year we're doing those 3 districts, and you can see that the more of the northern north, and then this far west part of our province. So District 3, just so you know, is like the London area, London, Windsor, Essex, all of those counties. 1 person being elected from that district. District 5 is the Sudbury area, all of these areas around it, so just get a sense of that. And District 6 is the far north, so Thunder Bay as far as Kenora. So large geographical areas, very important areas to be represented. And just to know, when you're elected to council, you're not representing your constituents. Your fellow your nominees and the people who elect you are electing you because you've got the competencies and they feel that you can make good decisions in the public interest. You are not there to represent their interests. It's not the same as a political, where you're saying I'm putting like a political candidate where that person is elected by us and they should do what we want. That is absolutely not how it is. They're electing you as a person with integrity that can make good decisions in the public interest, and they're trusting you to do that. So that's what the election is all about. Our elections process is 100% electronic, which is good. Given we have a pandemic, we don't have to worry about envelopes and that sort of thing, but make sure that your email is correct in your member profile on our registrant section of the college website, and everybody who's eligible for nomination and election will be getting an email when for nominations process, which actually the nominations open officially on today, which is December 2nd, and they'll go until January. And I think I've got the dates in my next slide. There we go. So today, December 2nd, the nominations officially open, and they officially close January 29th. I'm going to give people a lot of time this year. We know the pandemic definitely changes the available time that people have to do things. The voting opens on February 19th. It's all electronic, so everybody gets an electronic ballot, and it closes on March 4th. And we know very shortly after the voting closes on March 4th who has been elected in each district. So that is my formal presentation. I know we've got a couple of people on the line. If you want to ask some questions, please feel free to enter them into the question box, and I will certainly try my best to address them. And I'll give you a couple of minutes and see whether there's some questions that you have. I hope that you will consider standing for a nomination or putting someone forward that you feel has the competencies and integrity to do a good job in the public interest. Um, we certainly are interested in making sure everybody feels comfortable with the process. And even if you don't want to stand, making sure you participate in the election, read what the candidates' profiles are, and make a determination about which person you wanted to vote for. All that's good. I'm not seeing a lot of questions, but you certainly can contact me independently if you want to. If you want to leave a message at this email on your screen, we certainly will answer all of your election logistical questions. If you have more questions about the process or what it's like to be a council member, please feel free to send me an email. My email address is on our website. You can also send just a general question to info@codo.org, and we'd be pleased to answer that question. Or if you want to speak to someone, there's a phone number on the screen for you to ask. I thank you for your attention today. And with that, no questions. We'll call it a meeting. Thanks very much. We'll end it for now. Have a good day.